Kenya's new health agreement with the United States marks one of the most significant diplomatic shifts in East Africa in recent years. On the surface, it is presented as a 5-year, $2.5 billion partnership aimed at strengthening Kenya's health system and ensuring long-term support for programs such as HIV treatment, malaria prevention, tuberculosis control, maternal health, and disease surveillance. But the meaning of this agreement reaches far beyond health. It signals the start of a new era in American engagement with Africa, one shaped not by traditional development aid, but by direct political alignment and strategic calculations. For decades, the United States relied on USAID and large NGOs to manage its health programs across the continent. That model shaped everything from HIV treatment rollout to food security programs. It built institutions, trained workers, and created networks that functioned independently of African governments. When the Trump administration dismantled most of USAID's global health structure earlier this year, millions feared the funding pipeline would collapse entirely. Instead, Washington replaced it with a system in which support is offered directly to governments that choose to align themselves with American strategic objectives. Kenya became the first country to accept this new arrangement. President William Ruto has spent months cultivating a closer relationship with Washington, positioning Kenya as a reliable partner not only in health but also in security, trade, and regional diplomacy. When Kenya agreed to lead the multinational mission in Haiti, it sent a clear signal that it was willing to take on responsibilities that align with American priorities. This new health agreement is therefore more than a funding mechanism. It is a diplomatic statement that Kenya intends to become the United States' primary anchor in East Africa. The deal also offers Kenya something it has wanted for a long time: more control over its own health system. Instead of money passing through a patchwork of NGOs, funds will flow directly to Kenyan institutions. Supporters say this will strengthen state capacity and reduce the inefficiencies that often appeared in the old donor-driven system. It also gives Nairobi more influence over procurement and distribution, elements that have long been shaped by foreign organizations. By becoming the first country to sign, Kenya hopes to gain leverage for the upcoming bilateral trade agreement with Washington, which Ruto says could be finalized soon. That agreement could secure long-term access to the American market at a time when AGOA's renewal remains uncertain. But the move is not without controversy. Kenya's High Court issued a temporary suspension of the agreement, specifically blocking any transfer of medical or epidemiological data to the United States. This reflects a broader anxiety within the country that direct partnerships may come with hidden costs, especially when sensitive national data is involved. The court's intervention shows that Kenya's institutions are still capable of pushing back, even against major international deals, and it highlights how the debate over sovereignty now extends into digital and biological information. While Kenya has taken the first step, Uganda appears ready to follow. With USAID dismantled, Uganda's health system faces gaps that could destabilize critical HIV and maternal health programs. Kampala cannot afford to lose American support, and joining the new model may be the only viable path. Uganda also understands the political reality. Countries that maintain alignment with Washington receive funding, while those that challenge American policies face reductions or freezes. South Africa and Nigeria have already felt the consequences of disagreeing with Trump's administration, despite their massive HIV burdens and long histories of cooperation. What the United States wants is increasingly clear. Washington is competing with China, not only in roads and ports, but in influence, soft power, and long-term strategic positioning. Health systems, medical supply chains, and data networks are becoming instruments of diplomacy. By building direct partnerships with governments, the US hopes to regain space in a region where China has gained enormous economic leverage. The new agreements give Washington a foothold in East Africa's institutional architecture, while offering funding that many countries urgently need. For East Africa, the challenge is to navigate this new reality without sacrificing sovereignty or falling into dependency. Kenya and Uganda may benefit financially, but the region as a whole must consider whether it can negotiate from a position of strength. A fragmented approach leaves each country competing for deals individually. A more unified regional strategy could give East Africa the leverage it needs to shape these agreements on its own terms, ensuring that partnerships serve both national interests and long-term regional cohesion. What is happening now is more than a change in donor policy. It is the beginning of a new geopolitical chapter in East Africa, one in which global powers are openly competing for influence and where nations must choose their partners carefully. Kenya has stepped forward first, Uganda may follow, and the rest of the region is watching closely to see what this new era will bring. Is this the beginning of a stronger, more sovereign East Africa, or the start of a new geopolitical dependency? Follow us on Horn Daily for deeper analysis, and thank you for watching.